So this person wants to know what virtual nurses do. And I'm a virtual nurse, so I'm going to tell you. So first off, virtual nurses talk to the patients through the TV. And what I mean by that is there's a camera on top of their TV. And once you get the patient's permission to turn the camera on, the virtual nurse will come to the TV. The patient can see me, I can see them. It's like a big FaceTime call in the middle of their hospital room. So with that being said, some of the tasks that virtual nurses can do while they're in the patient's room, we do safety rounds. This can be done either once or 3 times a day. It just kind of depends. You know, like a safety round you do on the floor, making sure the patient has a fall bundle initiated, bed alarm on. If they got drips going, making sure those are going at the correct rate. If they got oxygen, making sure the oxygen is on them and actually on and flowing through the cannula. We also do pain assessments, and this is especially helpful if the bedside nurse already gave a pain medicine and they just need a reassessment. Can delegate that to the virtual nurse. We do a lot of patient education. If a patient is going down for surgery, we can do a pre-op checklist. If they're going for an MRI, we can do an MRI checklist. Virtual nurses also do medication sign-offs. So if you need a dual sign-off on blood, heparin, insulin, virtual nurses can come and sign off. Again, we'll call in through the patient's TV, zoom in on the bag, sign off, remote into the bedside nurse computer, put in our credentials, verify the order in Epic, and sign off just like that. That is probably the coolest part of the job. I don't care what nobody say, that's fire. Anyway, the main thing that virtual nurses do is admissions and discharges. For home discharges, the virtual nurse can put together the discharge paperwork, print it off, and the bedside nurse can take it in there to the patient. And then when I call in again through their TV, I can share my screen with the same paperwork that they have in their hands. And I will go over the paperwork with them just like that. For admissions, we basically do the entire admission process. We also do all the PTA med reviews. I personally haven't done this, but I've heard that virtual nurses can do skin assessments. Virtual nurses can also do care plans. We also respond to codes and stat calls. For obvious reasons, we're basically the scribe in those emergency calls. That's mostly the rundown of virtual nursing. Virtual nurses do work 312s. I work 7A to 7P. They also have night shift virtual nurses. Some virtual nurses work on site and some are remote. I am remote. Love it. But I'm seeing more hospitals hire virtual nurses, but they're on site. Yeah, that's the rundown on virtual nursing.